Hey there, it's Dr. Jim. Thank you for stopping by. I want to talk a little bit about one of my favorite topics. It's wrapped in person-centered care, one thing that I have written about extensively for more than a decade now. And there's a very important piece of person-centered care, and it specifically is the liberalized diet. Okay, very important. Lots of senior care communities around the country now have endorsed this diet, and it has seen some very good results. So, I'd like to talk about the importance of liberalized diets in senior care. So, person centered care has been around for some time now, and one of its main ideas is integrating a liberalized diet in senior care communities and especially skilled nursing centers. For decades, a traditional medical or therapeutic diet was provided to seniors, which was disease focused and very restrictive. And as a result, I would call it maybe an unforeseen side effect of the therapeutic diet was that many seniors experienced poor nutrition, malnutrition, and unintended weight loss. So they too experienced a decline in general health, well being, and quality of life. So, what is a liberalized diet? The liberalized diet is a comprehensive approach to health and nutrition and takes into account many factors, lots of characteristics of each individual. One's state of health, physician's orders, treatments, and food preferences are reviewed by the dietitian and an interdisciplinary staff. In other words, it takes a very highly individualized approach to diet instead of a one size fits all approach, which doesn't work almost in anything. So, taste matters. Meals should be enjoyable. Restricting things like fat, salt, sugar, starches, and carbohydrates simply takes a lot of flavor out of food, leaving it bland and tasteless. The liberalized diet promotes not only health, but quality of life and mealtime pleasure, mealtime happiness. I'd rather be happy when I'm eating than not, right? An added benefit of the diet is that seniors enjoy what they're eating and they increase their nutritional intake, which leads to better health and well being. It all makes sense. So, taste matters, so does choice. You know, choice is the big word in person centered care. The liberalized diet also supports the fact that each resident has the right to choose what they want to eat and when and where, quite frankly, they want to eat. A dietitian can oversee these rights and make sound choices concerning what may or may not be included in meals. In other words, everything within reason. Everything within reason. You can't throw reason out the window just because it's person-centered care. Now, along with malnutrition, I have read about and talked a lot about another problem which is related to it. Protein, energy, undernutrition. Okay? So it's a well-known fact that malnutrition is all too common in skilled nursing and has been largely associated with restrictive therapeutic diets. Along with a liberalized diet plan, supplements, texture of foods, and time when meals are served should all be taken into account. Another problem associated with malnutrition is protein energy undernutrition, which ranges between 23% to 85%, way too high, making poor nutrition a very serious and dangerous problem in senior care. Now, how do you start creating a liberalized diet? Where do you begin? The first place to start, very common sense, when designing an individualized diet for a newly admitted senior, is to sit down with them and conduct a comprehensive interview. Address what the individual likes to eat, or if they have any food allergies or food intolerances, and what their preferred dining environment is like. Do they like to be around a lot of people? Do they prefer to be in a corner or by a window? Do they prefer to eat in their room or in a smaller dining room? Lots of things to ask. Find out when the individual prefers to eat their breakfast, lunch, and dinner, because time also matters. Do they like snacks throughout the day? That might be a silly question. And what kind do they prefer? Do they like sugary stuff, sweet stuff, fruity stuff, chocolatey stuff, granola, whatever. So here are some final thoughts. Therapeutic diets were thought to be the best way to handle nutrition in senior care, and for decades. Through the philosophy, though, of person-centered care, it is now believed that the liberalized diet is a much better approach to the nutritional needs of seniors while enhancing their health and their quality of life. So, good stuff. The liberalized diet. I'm Dr. Jim. Thanks for stopping by. If you have not gotten into the liberalized diet yet in your skilled facility, assisted living, get into it more. Read about it. Talk to your team, or if you probably already have gone down this path, you could always make it better. I'll see you soon.